Bismillahirrahmanirrahim. Starting with the name of God who is most merciful and gracious. Hope you all will be fine. In this video, I discuss joint. Joint in anatomy, joint called articulation. In anatomy, joint known as articulation. Study of joint is known as arthrology, a point of contact between two bones, between bones and cartilage, or between bone and teeth. Joint is the point of contact between two or more bones, between bones and cartilage, or between bone and teeth. Structural classification of joint. In structural classification, joint based on anatomical characteristics, but in functional classification depend upon type type of movements of joints. Classification of joint: three type of joint: fibrous joint, cartilage joint, synovial joint. First type is fibrous joint. In fibrous joint, synovial cavity not present, rich in collagen fibers. In fibrous joint, rich in collagen fibers. Type of fibrous joint: three type of fibrous joint. First type is suture present in the skull. Second type is syndesmosis present in vertebra and pelvis. Third type of fibrous joint is gymphosis present only in mouth. Type of suture: first type is plain suture joint. Second type is serrate suture joint, and third squamous suture joint, and fourth denticulates suture joint. First type is plain suture joint. Plain suture joint present in internasal joint. Shape of plain suture joint in our body: this shape is plain suture joint present in our body. Second type is serrate suture joint. Serrate suture joint present in interparietal joint. Shape of serrate suture joint in our body: this shape is serrate suture joint in our body. Third type is squamous suture joint. Squamous suture joint present in temporal parietal joints. This shape is a squamous suture joint in our body. Denticulate suture joint present in occipital and temporal part. Denticulate means teeth shape present suture in our body. Cartilage, second type of cartilage joint, synovial joint, synovial cavity not present. In cartilage joint, bones held together by the cartilage. Bones held together by cartilage. In cartilage joints, bones held together by the cartilage. Slightly movable in our body. Cartilage joint also called epiarthrosis. Type of cartilage joint: first type is primary cartilage joint, and second is secondary cartilage joint. First type of cartilage joint, primary cartilage joint. Epiphyses and diaphyses are present in the plate known as groove plates. Growth age of primary cartilage joint 22 years. Bone's length increases in primary cartilage joint. Temporally cartilage developing into bones with the passage of time. Secondary cartilage joint, they are movable, they are mobile, lifetime available. In which time? Lifetime available. Synovial joint. Oval mean egg shaped structure. Oval mean egg shaped structure in synovial joint, greatest mobile among all the joint, contain cavity. Synovial joint contain cavity filled with fluid. Minoxis means separate the articulate surface. Synovial joint separate the articulate surface known as manicus. Known as manicus. Origin means attached to the immovable bone. Attached to the immovable bone. Insertion mean attached to movable bone. Non-axial movement known as sleeping movement. Non-axial movement known as sleeping movement. Uniaxial movement known as uni mean one, axial mean direction, one plane direction known as uniaxial movement. Biaxial movement, bi mean two, axial mean direction. Yeah, biaxial movement means two planes direction known as biaxial movement. Multiply movement in all the multiply movement in all the planes known as multiply movement direction. Gliding movement known as planar movement when one flat bone surface slip over another. Gliding movement present in ankles and wrist. Gliding movement present in ankle and wrist. Synovial membrane. Epithelial layer lines over the capsule secrete synovial fluid, thick and sticky in nature. Epithelial layer lines capsule secrete synovial fluid, thick and sticky in nature. Function of synovial membrane. In it play a vital role in the nourishment. The structure in cavity contain phagocytes. Phagocyte play a vital role in the remove of microbes and cellular debris. It act as a lubricant, joint stability, prevent the end of bones being separated. First function is nourishment. The structure in cavity contain phagocytes, remove microbes and cellular debris. Second function is lubricant, joint stability, prevent the end of bones being separated. Types of synovial joint. 7 types of synovial joints are present in our body. First type is plane joint. Plane joint also called gliding joint. In gliding joint, no angle changes. Gliding joint are present in tarsal and carpal bones. Hinge joint present in elbow joint and knee joints. Ball and socket joints, ball shaped joint present in shoulder and hip joint. Ellipsoid joint present in the wrist joint. Saddle joint present in calcaneum and cuboid bones. Saddle joint present in calcaneum and cuboid. Pivot joint are present in the head movement and also proximal radioulnar joint. Condylite joint are present in knee. Synovial joint, also known as types of joint on the basis of function. Diarthrosis, synoarthrosis, epiarthrosis. Synovial joint, also known as diarthrosis. means freely movable in our body. Synostosis, sign mean together. Immovable joint present in cranium, part of skull. No movement in this type of joint. Third type of joint on the basis of function, arthrosis, present on both sides, slightly movable joint, present in intervertebral joint. In arthrosis, less movement present in arthrosis joint. Second, diarthrosis, freely movable joint present in shoulder and hip joints. Monoaxial joint present in pivot joint, hinge joint. Biaxial joint present in planar joint also called gliding joint. Condylined joint, planar joint is also called gliding joint in which no angle changes. Triaxial joint present in saddle joints, ball and socket joints. Classification of joints on the basis of lumbar. Three type on the basis of lumbar. First type is simple joint. Simple joint present in interphalangeal. Compound joint present in wrist. Complex joint present in sternoclavicular joints. Joint present in skull or immovable. Limb type joint freely movable in our body. Synovial membrane consists of albumin, hyaluronic acid, and phagocytic cell. Carpometacarpal joint present between trapezium of the corpus and metacarpal of the thumb. Joint are known as saddle joint present. Saddle joint are present. I again explain these terms of joints. Joint in anatomy, joint known as articulation. Arthrology, study of joint known as arthrology. Point of contact between bones and cartilage or between bones and teeth. Structure classification depends on anatomical characteristics. Functional classification depend on type of movement. Classification, three type of joint: fibrous joint, cartilage joint, synovial joint. Synovial joint, fibrous joint in which no synovial cavity present or rich in collagen fibers. Type of fibrous joint, three type of fibrous joint: suture fibrous joint, syndesmosis, gymphosis. Suture joint present in skull and syndesmosis present in vertebra and pelvis. Gymphosis present only in our mouth. Suture joint present only in skull. Type of suture joint, four type of suture joint: plain suture joint, also called gliding joint, in which no angle changes. Second type is serrate suture joint. Third type is squamous suture joint. Fourth type is denticulate suture joint. Plain suture joint present in internasal joint. Shape of plain suture joint: serrate suture joint present in interparietal joint. Shape of serrate suture joint. Squamous suture joint present in temporal parietal joint. Squamous suture joint. Denticulate suture joint or teeth shaped joint present in occipital temporal. Cartilage joint in which no synovial cavity present. Bones held together by the cartilage. Bones held together by the cartilage. Cartilage joint are slightly movable and also known as arthrosis. Type of cartilage, two type of cartilage joint. First type is primary cartilage joint. Second type is secondary cartilage joint. Primary cartilage joint are present in epiphyses and diaphyses plate known as growth plate. Growth age 22 years. Bone length increases. Temporally cartilage developing with the passage of time. Scandi cartilage joint, they are mobile and their lifetime are evaluable. Synovial joint greatest mobile and also contain cavity filled with fluid. Meniscus synovial joint separate the articulate surface known as meniscus. Origin known as attached to the immovable bones. Insertion means attached to the movable bones. Non-axial movement known as sleeping movements. Uniaxial movement present in one plane. Biaxial movement present in two planes. Multiply movements present in all the planes. Direction gliding movement when one flat bone surface slip over another. Gliding movement present in ankle and wrist. No angle changes during the gliding movements. Synovial membrane epithelial layer lines capsule secretes synovial fluid, nature thick and sticky. Function nourishment the structure in cavity, contain phagocytic, remove microbes and cellular debris. Lubricant joint play vital role in stability, prevent ends of bones being separated. Type of synovial, 7 type of synovial joint. First type is plain joint, hinge joint, ball and socket joint, ellipsoid joint, saddle joint, pivot joint, condyloid joint. Plain joint present in tarsal and carpal bones. Hinge joint present in elbow and knee joint. Ball and socket joint present in shoulder and hip joint. Ellipsoid joint only present in wrist. Saddle joint present in calcaneum and cuboid bones. Pivot joint present in head movement and also proximal radio-ulnar joint. Condyloid joint present in knee. Synovial joint also known as diarthrosis. They are freely movable. Synarthrosis, syn mean together, immovable joint present in cranium part of skull in which no movement occur. Ampiarthrosis on both side, present on both side, slightly movable joint present in vertebral joint in which less movement occur. Diarthrosis freely movable joint present in shoulder and hip joint. Monoaxial joint present in pivot joint, hinge joint. Biaxial joint present in planar joint and condyloid joint. Triaxial joint present in saddle joint and ball and socket joints. Classification of joint on the basis of lumbar. 3 type of joint on the basis of lumbar. First type is simple joint. Simple joint present in interphalangeal bones. Complex joint present in wrist. In complex joint also present in sternal clavicular joint. Compound joint present in wrist. Complex joint present in sternoclavicular joint. Limb type of joint are freely movable joint. Synovial membrane consists albumin, hyaluronic acid and phagocytic cells. Carpometacarpal joint between trapezium of the corpus and metacarpal of the thumb joint or named saddle joint present. Thank you for watching this video.